Hi everyone, my name is Barzilay. I'm a child psychiatrist and assistant professor at the University of Pennsylvania and the Children's Hospital of Philadelphia. And I'd like to thank the organizers for inviting me to speak to you about a project we recently launched online where we measured stress, resilience, and mental health during the COVID-19 pandemic outbreak. Let's start. Short disclosure, I serve on the scientific board of a startup company, and nothing I do over there pertains to any part of what I will present to you today. A brief overview of my talk. I'm going to start with an intro of our efforts studying risk and resilience at the Lifespan Brain Institute of UPenn Penn. And then I'll dive into the context of COVID-19 as a major stressor, but also an opportunity to study resilience. And lastly, I will talk about our experience collecting data at times of social distancing during COVID-19. And I will specifically share with you some findings we gathered from the website we launched called covid19resilience.org. We'll start by describing to you how we study resilience at the Lifespan Brain Institute, LIBI. So 3 years ago, in 2017, we embarked on a journey to establish the tool that will provide a good understanding and will capture well the multifaceted nature of resilience. And we did it through integrating multiple questionnaires into a single battery, and these questionnaires were chosen after we did an extensive review of the literature, and we came up with a plan of what are the traits that tap to resilience, and you can see here the myriad of questionnaires we used. It was a long battery of questions, 212, and we administered this to kids who came to our lab for the 2.5 years from 2017 to 2019. And after we had data from around 300 young adults and adolescents, the age was from 8 to 35. We analyzed the data, and when I say we, I primarily mean Dr. Tyler Moore, the statistician in our lab, and we managed to trim the questionnaire from 212 questions to around 45 questions with keeping a precision of an alpha of 0.8. What was interesting is that the questionnaire resulted in 7 factors of risk and resilience. What were these factors? You can broadly define them or divide them to factors that tap into intrapersonal traits like self-reliance and emotion regulation, traits that have to do with the relationships, your close relationships, aspects in your close relationships, either positive and negative like hostility. And we also had factors that tap into the environmental context and resilience. One had to do about how you conceive your neighborhood environment, and 2 had to do with experiences like peer victimization or life events. And what we've shown is that at least in the 300 participants on which we established the tool, we found the correlation or the direction of correlations as we would expect, namely the higher you scored on resilience, the lower you scored on psychopathology, and vice versa. And we saw it in 3 different domains of psychopathology: depression, anxiety, and psychosis. What are the items that we actually ask about? So one of them, or the first 2, self-reliance and emotion regulation or dysregulation, are intrapersonal, as I mentioned. The second 2 are aspects in relationships, positive and negative. And the 5th one is the neighborhood scale, which taps into environment. So if you may recall, we originally had 7 factors. 2 of them had to do with peer victimization or negative peer experience and life events. But here I focus on the 5 factors that you see here, which are the factors we used during the study and we did and during the COVID-19 pandemic. COVID-19 is a global adversity, stressor, calamity, and it has implication to mental health. And you see here a collection of papers that came out over the last month, some of them in June, but most are July 2020, in the biggest journals all over the world. It's a global adversity in China, data from China, UK, from the US. And when we look about the research agenda that is described very nicely by the NIMH director, Josh Gordon, in biological psychiatry, one of the foci that is very, I would say, tempting to study during these high times of stress is the construct of resilience, because resilience can be evaluated in times of stress, and COVID-19 presents a major stressor for people all around the world. During March, when the COVID-19 pandemic reached the US, we took the opportunity to study resilience using this online study we launched. And I'll just share with you what was the time frame of the study. So on March 13th, the university was closed and the schools in Pennsylvania were shut down. And within a couple of days, all non-essential businesses were shut down. And this is where we thought, well, something big is happening, something stressful is happening. Let's try to capitalize on the opportunity and study resilience. But because it was a time of social distancing, we needed to change our ways. And prior to COVID-19, we only evaluated people in person in the lab. So we needed to think of a methodology that will allow us to collect data long distance or remotely. So we put in an online study. We had our IRB submission ready in 2 weeks, and a week later, April 6th, we launched the study after we established the website that I will share with you in the next slide. And the data that I will focus on presenting you today is data collected in the first 10 days of data collection. Let's see what we found. So we established a website which is very inviting, and we put a lot of focus on and effort on the user experience. So once you get to the website, and I encourage all of you to give it a try, covid19resilience.org. You see this nice inviting picture of people or cartoon from people of all sizes and colors. And then you're invited to start the survey to take it. And we promise you that you get a personalized feedback within a couple of minutes. You then go through a consent page. This, of course, the study was approved by Penn IRB. And then you are being asked some questions on your demographics, on some stress-related items or items related to stress during COVID. Then you take the resilience survey that I showed you in the beginning of the presentation, 21 items, 5 factors. Then you get a personalized feedback. We use the feedback both to give people something back, but also to be an incentive for people to give us valid responses, because if people want to get a valid feedback, they will take the questionnaire or the survey seriously. Then we ask for permission to recontact. I will not present to you data, longitudinal data today, but I'm very proud to say that we collected a substantial amount of longitudinal data. And then to link the resilience survey with a viable psychiatric construct, we asked some question about current mental health, that is anxiety, depression, and sleep or insomnia. Then we give some feedback about the data that the participant presents or provides. And then we ask again for permission to recontact with the hope that people will leave their email so we can get back to them in the future. Some basic demographics on the population that replied to the survey. We used our own social networks, mainly Twitter. We used our university and hospital contact list and organizational emails. We used our network internationally to get the word out in other places outside of the US. And the population was, at the end of the day, enriched for women, females, around 70%. We had a nice population in terms of the lifespan perspective. You see people from the 20s and all the way to over the 70s. And our most, I would say, prominent bias is that the population who took the survey, because of the way we got to people, is mainly academics, and we have more than 50% from a master degree education and above. We had some people who were tested for COVID, although it was not enriched for people who were positive for COVID. We had only 12 of them in the first 3,000. And let's see what we found. I would say biggest finding is that when we look at what are people stressed about during COVID, people are more stressed or worried about others than about themselves, and specifically they were worried about their family contracting COVID or getting COVID, and they were worried about unintentionally infecting others. And this was stronger worries compared to worries about self, contracting COVID yourself, dying from COVID, or currently having COVID. Another finding is that the worries regarding contracting COVID were comparable to the financial worries of the burden that COVID-19 brings upon people. And because we had a lot of participants, we could control a covariate for multiple covariates. And here in this model, we used age, gender, education, income, marital status, number of people in household, things like that. But the results were robust for that. We saw some gender differences as expected in terms of mood and anxiety. Women were generally more stressed and more worried about COVID-19 related stuff compared to males, except for money, where males and females worried to the same extent. And from the lifespan perspective, we saw that generally the older you were, the less you were stressed or worried about COVID-19. And this is a consistent finding with the literature of papers that came out since our study. About the resilience profile. So our first run at the data was to see how the resilience tool we developed captures COVID-19 related or captures the buffering effect of resilience on COVID-19 related stress and anxiety depression. And what we found is that generally the questionnaire, when we sum up the items of resilience, captures nicely a resilient trait, meaning the higher you score on resilience, these are the guys in green here, the top resilience tertile, the lower you score on all of the worries. And this always also translated to actual anxiety and depression. And here we see that the higher you were on the resilience tertile, again, people in the green bar, they had lower chances of meeting threshold criteria for anxiety and for depression, as we would expect it, but we were very happy to see that the tool was valid, because remember, the tool was developed for years before the onset of COVID-19, and it was not intended to capture resilience in the face of a pandemic. It is more a generic resilience tool. About the different factors of resilience. So this is something we are analyzing now, and I'd like just to give you a taste for it. And here we see a correlation matrix that was derived using a structural equation model that takes together both the factors of resilience and the different psychopathology domains that we looked at and the different worries. And basically what we see is that resilience factors correlate with each other. And you see all the correlations here are positive. This is green, but they do not totally overlap. So the strongest correlations are from self-reliance to emotion, between self-reliance and emotion regulation, and they are under 0.5, which suggests that there is an added value of using a tool like we use for resilience that taps to different factors that comprise resilience. And we think that this tool brings more than the sum of its own parts, i.e. the factors, and it can tap on a more, I would say, dynamic construct of resilience, a more complicated construct of resilience that is not captured by each of the specific factors. And another finding that we have is that out of the factors, when we look at the correlation with psychopathology or with worries, using the negative correlations here in red, we see that the factor that looks to have the strongest buffering capacity is emotion regulation. And we postulate that emotion regulation may be a focus for treatment for enhancing resilience. I'd like to emphasize that this was a team effort, and wouldn't be able to do any of this without the contribution of each of the guys that you can see here. Tracy Domenico, my lab manager at Penn at the Barzilay lab, David Greenberg from Bar-Ilan University, Lily Brown from Penn, the director of Penn Anxiety Center, Tyler Moore, the statistician I described before, Lauren White helped generate the resilience tool, and of course my mentors, professors Ruben and Raquel Gur from the Lifelong Learning Institute of Chopin Penn. I'd like to thank my funders, NIMH and the Children's Hospital of Philadelphia. If you'd like to hear more about our studies, I invite you to look at our website, to follow us on Twitter, or you can contact me directly. Thank you for your time. Bye-bye.